And welcome to this product demonstration video where we're going to show you a ecstasy screening test for human urine. This is a new test strip we're importing in from All Tests, which is a CE marked in vitro diagnostic quality screen which will detect if ecstasy has been consumed for between 3 and 5 days in human urine sample obtained after usage. Now, the test strip itself is very easy to use. We're just going to show you the foil pouch here, which you've been looking at for a couple of seconds. If we just rotate it over and show you the reverse of that foil, you'll see it's MDMA, which is the abbreviation for ecstasy. It's a rapid test dip strip for urine. And on here you've got information about the catalogue code, the lot number and the expiry date, together with the European representation for the CE quality certification and the manufacturer's detail, which is All Test Biotech. So if we open this up and show you what's included in the test, just rip open the foil pouch, put some air in, and we should be able to remove our test strip. And inside there you'll also see a little bag of desiccant, which is the moisture absorbent fluid to keep the test strip in peak condition. And here we have the coding again showing on the panel. If I just zoom in there and get it into focus for you, MDMA coding nicely on the handle end of the test strip. Maximum dip line indicated by the arrows with a straight line with the wavy lines underneath. So what I'm going to do now is just remove this test strip and put it into a simulated urine sample for you. You keep it in the urine for between 3 and 5 seconds just to get adequate absorption. And as soon as you see the pink dye wicking in the centre of the test strip section, as indicated here, you can remove it and lay it on a flat non-absorbent surface. And now we're just watching that pink dye osmotically be pulled up the body of the test strip towards the handle end. And you will see gradually developing in front of your eyes 2 lines forming in this instance, indicating a negative test result. Now I'm just going to talk a little bit about those 2 lines on there, because this is important with test strips, because there's no guide on there, no plastic housing to indicate which is which. But a control line must always form for these tests. Now the control line will form within 5 mils of the handle end where the coding is. Then you're looking for the presence or absence of a test line, which is the line that forms about 5 mils from the dipped end in the central narrow section. So on here we can see quite clearly, if I indicate them for you, this is the test line and this is the control line. And we have a clear indicator of a negative test, indicating that in the buffer sample I've just added this test with, there is no evidence of MDMA or metabolites being present, and that would indicate a clear negative result. Now in this instance you can see how nice and clear those 2 lines are. In other tests you may find that the line specific colour, density, saturation and thickness varies, and in some cases the test line may be very thin and faint. A lot of physiological variations occur in urine which can affect the densities of these colour bands, and also depending on the drug group on the test that you're using, there will be some variation on the cut-offs and colour density showing. If there is any test line showing in the presence of a clear control line at specified read time for the test, you must categorise that as a clear negative result.